So the question of preoperative therapy in those patients that are resectable or borderline resectable is also one where we think of maybe moving drugs into this disease setting. I say drugs with or without radiation therapy is also a question that, at least in retrospective reviews, appears fairly compelling. And now we have a prospective study that would suggest that this approach is safe and tolerable and may result in a more favorable impact in going to operation alone. I think that operation initially. I think that there are a couple of things to take into consideration. One, the data from the trial that was presented, we'd like to see what the mature data set looks like. Secondly, getting these patients from diagnosis to an evaluation where they can be considered for their preoperative therapy oftentimes is a bit of a challenge. And so it still may be the work of centers that focus on hypofractionated radiation, for instance. And so I think it's compelling, and it's a direction it will likely move in, but it's one that we will probably move in cautiously because patients diagnosed in the community, for instance, may not have access to these approaches. And then again, this is probably more for a fit population, but very compelling, and answers a question that many of us had in the field about neoadjuvant therapy prior to an operation.